COVID-19 outbreak continues to evolve, comparisons have been drawn to influenza. Both cause respiratory disease, yet there are important differences between the two viruses and how they spread. This has important implications for the public health measures that can be implemented to respond to each virus. Firstly, COVID-19 and influenza viruses have a similar disease presentation. That is, they both cause respiratory disease, which presents as a wide range of illness from asymptomatic or mild through to severe disease and death. Secondly, both viruses are transmitted by contact, droplets, and fomites. As a result, the same public health measures, such as hand hygiene and good respiratory etiquette, coughing into your elbow or into a tissue and immediately disposing of the tissue, are important actions all can take to prevent infection. The COVID-19 and influenza viruses is different. The speed of transmission is an important point of difference between the two viruses. Influenza has a shorter median incubation period. The time from infection to appearance of symptoms and a shorter serial interval the time between successive cases than COVID-19 virus. The serial interval for COVID-19 virus is estimated to be 5 to 6 days. While for influenza virus, the serial interval is 3 days. This means that influenza can spread faster than COVID-19. Further, transmission in the first 3 to 5 days of illness, or potentially pre-symptomatic transmission of the virus before the appearance of symptoms is a major driver of transmission for influenza. In contrast, while we are learning that there are people who can shed COVID-19 virus 24 to 48 hours prior to symptom onset, at present, this does not appear to be a major driver of transmission. The reproductive number, the number of secondary infections generated from one infected individual, is understood to be between 2 and 2.5 for COVID-19 virus, higher than for influenza. However, estimates for both COVID-19 and influenza viruses are very context and time specific, making direct comparisons more difficult. Children are important drivers of influenza virus transmission in the community. For COVID-19 virus, initial data indicates that children are less affected than adults and that clinical attack rates in the 0 to 19 age group are low. Further preliminary data from household transmission studies in China suggest that children are infected from adults, rather than vice versa. While the range of symptoms for the two viruses is similar, the fraction with severe disease appears to be different. For COVID-19, data to date suggests that 80% of infections are mild or asymptomatic. 15% are severe infection, requiring oxygen, and 5% are critical infections, requiring ventilation. These fractions of severe and critical infection would be higher than what is observed for influenza infection. Those most at risk for severe influenza infection are children, pregnant women, elderly, those with underlying chronic medical conditions, and those who are immunosuppressed. For COVID-19, our current understanding is that older age and underlying conditions increase the risk for severe infection. Mortality for COVID-19 appears higher than for influenza, especially seasonal influenza. While the true mortality of COVID-19 will take some time to fully understand, the data we have so far indicate that the crude mortality ratio, the number of reported deaths divided by the reported cases, is between 3 to 4%, the infection mortality rate. The number of reported deaths divided by the number of infections will be lower. For seasonal influenza, mortality is usually well below 0.1%. However, mortality is to a large extent determined by access to and quality of healthcare. While there are a number of therapeutics currently in clinical trials in China and more than 20 vaccines in development for COVID-19, there are currently no licensed vaccines or therapeutics for COVID-19. In contrast, antivirals and vaccines available for influenza. While the influenza vaccine is not effective against COVID-19 virus, it is highly recommended to get vaccinated each year to prevent influenza infection. The difference between influenza or flu and COVID-19. Influenza or flu and COVID-19 are both contagious respiratory illnesses, but they are caused by different viruses. COVID-19 is caused by infection with a new coronavirus called SARS-CoV-2, and flu is caused by infection with influenza viruses. COVID-19 seems to spread more easily than flu and causes more serious illnesses in some people. It can also take longer before people show symptoms, and people can be contagious for longer. More information about differences between flu and COVID-19 is available in the different sections below. Because some of the symptoms of flu and COVID-19 are similar, it may be hard to tell the difference between them based on symptoms alone, and testing may be needed to help confirm a diagnosis. While more is learned every day about COVID-19 and the virus that causes it, there is still a lot that is unknown. Signs and symptom similarities. Both COVID-19 and flu can have varying degrees of signs and symptoms, ranging from no symptoms asymptomatic to severe symptoms. Common symptoms that COVID-19 and flu share include fever or feeling feverish/chills, cough, shortness of breath or difficulty breathing, fatigue or tiredness, sore throat, runny or stuffy nose, muscle pain or body aches, headache. Some people may have vomiting and diarrhea, though this is more common in children than adults. Differences of flu. Flu viruses can cause mild to severe illness, including common signs and symptoms listed. COVID-19 seems to cause more serious illnesses in some people. Other signs and symptoms of COVID-19, different from flu, may include change in or loss of taste or smell. Symptoms appear after exposure and infections. For both COVID-19 and flu, 1 or more days can pass between a person becoming infected and when he or she starts to experience illness symptoms. The differences. If a person has COVID-19, it could take them longer to develop symptoms than if they had flu. Typically, a person develops symptoms anywhere from 1 to 4 days after infection. Typically, a person develops symptoms 5 days after being infected, but symptoms can appear as early as 2 days after infection or as late as 14 days after infection, and the time range can vary. Someone can spread the virus. For both COVID-19 and flu, it's possible to spread the virus for at least 1 day before experiencing any symptoms. The differences. If a person has COVID-19, they may be contagious for a longer period of time than if they had flu. Most people with flu are contagious for about 1 day before they show symptoms. Older children and adults with flu appear to be most contagious during the initial 3 to 4 days of their illness, but many remain contagious for about 7 days. Infants and people with weakened immune systems can be contagious for even longer. Spreading the virus that causes COVID-19 is still under investigation. It's possible for people to spread the virus for about 2 days before experiencing signs or symptoms and remain contagious for at least 10 days after signs or symptoms first appeared. If someone is asymptomatic or their symptoms go away, it's possible to remain contagious for at least 10 days after testing positive for COVID-19. Both COVID-19 and flu can spread from person to person, between people who are in close contact with one another within about 6 feet. Both are spread mainly by droplets made when people with the illness COVID-19 or flu cough, sneeze, or talk. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It may be possible that a person can get infected by physical human contact, for example, shaking hands, or by touching a surface or object that has virus on it and then touching their own mouth, nose, or possibly their eyes. Both flu virus and the virus that causes COVID-19 may be spread to others by people before they begin showing symptoms, by people with very mild symptoms, and by people who never developed symptoms called asymptomatic. The difference between COVID-19 and flu viruses are thought to spread in similar ways. COVID-19 is more contagious among certain populations and age groups than flu. Also, COVID-19 has been observed to have more super-spreading events than flu. This means the virus that causes COVID-19 can quickly and easily spread to a lot of people and result in continuous spreading among people as time progresses. Both COVID-19 and flu illness can result in severe illness and complications. Those at highest risk include older adults, people with certain underlying medical conditions, pregnant people. The differences are risk of complications for healthy children is higher for flu compared to COVID-19. However, infants and children with underlying medical conditions are at increased risk for both flu and COVID-19. Young children are at higher risk of severe illness from flu. School-aged children infected with COVID-19 are at higher risk of multi-system inflammatory syndrome in children, a rare but severe complication of COVID-19. People at increased risk of COVID-19 severe illness of older men and pregnant women. Both COVID-19 and flu can result in complications, including pneumonia, respiratory failure, acute respiratory distress syndrome, fluid in the lungs, sepsis, cardiac injury like heart attacks and stroke, multiple organ failure, respiratory failure, kidney failure, shock, worsening of chronic medical conditions involving the lungs, heart, or nervous system, or diabetes, inflammation of the heart, brain, or muscle tissues, secondary bacterial infections. Infections that occur in people who have already been infected with flu or COVID-19. Most people who get flu will recover in a few days to less than 2 weeks, but some people will develop complications. Additional complications associated with COVID-19 can include blood clots in the veins and arteries of the lungs, heart, legs, or brain. People at high risk of complications or who have been hospitalized for COVID-19 or flu should receive supportive medical care to help relieve symptoms and complications. Prescription influenza antiviral drugs are FDA approved, Food and Drug Administration, to treat flu. People who are hospitalized with flu or at high risk of flu complications with flu symptoms are recommended to be treated with antiviral drugs as soon as possible. The National Institutes of Health has developed guidance on treatment of COVID-19 external icon, which will be regularly updated as new evidence on treatment options emerges. While remdesivir is an antiviral agent that is being explored as a treatment for COVID-19 and is available under an emergency use authorization, there are currently no drugs or other therapeutics approved by the Food and Drug Administration, FDA, to prevent or treat COVID-19. What to do if you are sick with COVID-19? Vaccines for COVID-19 and flu must be approved or authorized for emergency use, EUA, by the FDA. There are multiple FDA-licensed influenza vaccines produced annually to protect against the 3 or 4 flu viruses that scientists anticipate will circulate each year. 2 COVID-19 vaccines have been approved for use by the FDA under an EUA. Other vaccines to prevent COVID-19 are still under development. Influenza epidemics have been considered suitable for use as a model for the COVID-19 epidemic, given that they are respiratory diseases with similar modes of transmission. However, data directly comparing the two diseases are scarce. 89,530 patients with COVID-19 and 45,819 patients with influenza were hospitalized in France during the respective study periods. The median age of patients was 68 years, interquartile range 52 to 82 for COVID-19 and 71 years 34 to 84, for influenza. Patients with COVID-19 were more frequently obese or overweight, and more frequently had diabetes, hypertension, and dyslipidemia than patients with influenza, whereas those with influenza more frequently had heart failure, chronic respiratory disease, cirrhosis, and deficiency anemia. Patients admitted to hospital with COVID-19 more frequently developed acute respiratory failure, pulmonary embolism, septic shock, or hemorrhagic stroke than patients with influenza, but less frequently developed myocardial infarction or atrial fibrillation. In-hospital mortality was higher in patients with COVID-19 than in patients with influenza. 15,104, 69% of 89,530 versus 2,645, 8% of 45,819. With a relative risk of death of 2.995%, class interval 2.8 to 3.0, and an age standardized mortality ratio of 2.82. Of the patients hospitalized, the proportion of pediatric patients 18 years was smaller for COVID-19 than for influenza, 1,227, 14% versus 8,942, 19.5%, but a larger proportion of patients younger than 5 years needed intensive care support for COVID-19 than for influenza, 14.23% of 613 versus 65.09% of 6,973. In adolescents 11 to 17 years, the in-hospital mortality was 10 times higher for COVID-19 than for influenza, 5.11% of 458 versus 1.01% of 804, and patients with COVID-19 were more frequently obese or overweight.